Good day, my friends. Haven't talked with you in a week. It feels like a week. Look at this. It's a little one. I couldn't reach it. I wanted to get a great big one on the top, but oh, baby. This little baby's not got long to live. I'm sorry. But look at this. The Valencia Prides. We got a young lad down in the next town here. He's got all kinds of rare mangoes of all varieties. We'll just see when they get big. He claims they're better than these, so we're just going to see. Yeah. Oh, Trish and Martin. You guys, some of you probably won't maybe remember Martin. These are two tapes of his, very excellent music. And cool stuff. You might have heard of Iron Butterfly. Inagata da vida, baby. Oh, good, my friend, you're doing good. Kicking butt, these guys. But Trish, I'm gonna have to, I don't know. This is unbelievable. Look at this. The Tree of Life. This is an amazing gift. And the paper in here is like it's just cut from the tree. Just tree paper. It's amazing. And incorrigible. Thank you, sweetheart. I hear you're tearing it up over there. Fantastic. Isn't it cool to help people get well? And, you know, all the old band members, I'm an old rock and roller myself, 12-stringer and an organ, and I tell you, we all got to get healthy from those old days of a little wildness. I think this card is unreal. That is a wood butterfly. Trish, unreal, my dear one. Love you, dear. Love you guys so much. Thank you so much. I got some good music to listen to. Thank you. Bottom of the heart, man. You know, it does feel good helping others and turning this world around a little bit. It's amazing out there, isn't it? But you keep working with people, and people are awakening and helping themselves, and it's just, I was just talking to one lady that's went through hell, had to have some resections done to her colon and stuff, and they took out a bunch of lymph nodes. They didn't even ask her, 19 of them. So, you know, it's all these sort of things. There's so much out there. Look at this one. And this is a sad one here. And I want to ask you, what would you guys do with this case? Hi, I have a stage 4 tonsil cancer. I didn't even read that one. I didn't even read that part. That's not what's highlighted for me to look at. Hi, I have a stage 4 tonsil cancer and have been using various herbal supplements. I'd like to have a 14-week program drawn up for me, please, to help this heal this. Oh, absolutely. So, who is this? This is Carol. You know, sweetheart, I'm putting myself immediately on an extended grape fast of maybe 20 days. I'm going right after this. I'm going to start putting astringents here. I'm probably going to sip on that 3-lung tea because it breaks up hardened sputum in the tissues here. So I'd be doing that, of course. Maybe even add the lung formula to the protocol, but I'm going right after my kidneys, my adrenals. I'm going after my lymphatics. I got to get this all drained here. Neural lymphatic points are right here. Ow, 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 ow. They could hurt. But these neurolymphatic points are here and down the back. You want to get that lymph moving. Get yourself sweating and all this. Open the doors because this is all around the throat. So it's possible you're dealing with a suppressed thyroid because of the same problem. Lymph stagnation in all these tissues here. So yeah, you want to get honking on that. But get this. Equally. My 17-month-old granddaughter has a condition called SOD, as she was born without a pituitary gland. Wow. 17-month-old baby without the main master gland. And that's what you're seeing. This is what I've been saying for how many years? We're in trouble in the human race. If this particular dream wants to continue, the human race has to understand what's going on genetically. And the wiping out of a whole tissue genetically is in the process. People are born without kidneys now, or one kidney. I mean, it's a mess. Poor little girl born without a face. I mean, it's just like, Jiminy Christmas. Don't we wake up yet? We're going to keep going down the medical route? Take a look at where we're at because of that. That you have to add that. That's the one thing. Just like in this country, I guess the Democrats have to own Obamacare or something like that. Well, guess who has to own this? The medical community. You know, when you don't understand what causes problems and you're treating with these deadly, toxic pharmaceuticals, and you're just controlling symptoms for what reason? Just so you feel better. And you know, there's little focus on causative factors. And that's what we all have to realize. What's the cause of all these problems? Let's take out the concept of diseases for a minute and start looking at what are you doing to cause these problems? And that's the question you have to ask. Well, the one thing we do is our physical bodies are food processors. Could it be we're processing the wrong types of food? See, there's two types of food out there. There's acid ash forming foods, and there's alkaline ash forming foods. In other words, there's alkaline forming foods and acid forming foods. Guess what your body doesn't like? Acid forming foods. Nobody does. Very few creatures on this planet, believe it, including bears, including the omnivores, like acid forming foods. They have to eat them sometimes for survival, but they very much go to the greens and that sort of thing as well. The berries and things like that, the more base or alkaline ash forming foods, because it's the ash that you get the blowback from, of course, and then the process involved in that. For example, like meat protein, you're initiating complex proteins, whether it's meat or bean, you're going to initiate hydrochloric acid in a complex structure which the body cannot use. That's obvious. Then your body has to go to extra energy loss and extra activity just to break this stuff down. And of course, when you start getting into brick walls instead of 2x4 walls, you're going to have a wrecking ball this time. Karate can't tear it down. So you're going to have a wrecking ball, and that's just what you need. It's just what an acid is in the stomach. Hydrochloric acid and pepsin is a wrecking ball. It tears apart these complex amino acid structures, amino acid, peptide, polypeptide, all those structures, tears them apart to get down to the amino acids before your body can even use them. So the argument about proteins is ridiculous. You know, because your body can only use the amino acids in the first place. So the argument is just so ridiculous. And the initial hit from the acid ash part of this is acidifying to the human body and damaging to the colon and the kidneys, particularly the eliminative organs. So, 'twas me on these two cases. At a 17-month-old, she's going to be on fruits. She's a little islander. For a 17-month-old baby is going to be on solid fruits, berries, and melons in my world. And you're going to initiate, I'm going to be working with the pituitary. I'm going to use herbs, and I might even use a little shade of a glandular, just a little bit, just to see if I can evoke any stem cell or any to regenerate the pituitary. I did it on a thyroid once where there was only just a little piece. I regenerated the whole thyroid. Now, it's possible to do it in the pituitary as well. She's only 17 months, so there is a growth factor. Now you want to take a look at this little girl because she does have growth hormones where else. Very few people know this one, and you guys are the premier group to know that. There are other growth hormones from what gland? The thymus gland. The problem is the pituitary controls everybody, but the thymus gland. So I would probably be giving her a little thymus tissue to inspire thymus gland function. I would be also, if I was her physician, I'd be pulling T cells just to see what her T cells look like, just to look and see if she hadn't got a thymus problem, because then this little girl is in for some serious growth problems and just serious stuff. So really we need to try to inspire new growth of a new gland here. And it sounds ridiculous, but the body regenerates at these high levels. It was like this lady I was just talking to went into surgery. She had put herself on like a 20 or 30 day grape diet before it. The surgeon said there was no bleeding. She had a bowel resection. No bleeding. He said, I can't believe it. What were you doing? No bleeding. And remember I said that when you get high up on these levels, you can cut yourself, you don't feel it, it doesn't bleed, and the next thing you know, it's gone? I've experienced that. Arnold Ayers experienced that. Many of you have told me you're experiencing these levels. Is that cool or what? Huh? Is that cool? Uh-huh. How about you ladies that are used to heavy menses and everything? Clean that up and you hardly even spot. Is that cool or what? Absolutely cool. And you don't have to go through your life suffering and all these things. Ridiculous stuff. So it is all cool to be healthy and strong and viral. Absolutely. But the one with the mother, I guess, with the stage 4 tonsil cancer, I don't care what stage it is, that's the degenerative stage, right? But you turn that right around, and it'll rock back right through the chronic, subacute, and acute stages. You got to back up through these stages. Remember, we talked about that on a couple of videos ago. You're going to walk back from where you stopped. So if you stopped in the chronic levels, you've got to walk back through the acute and subacute and acute, and there's where symptoms are going to be. So you can have the same symptoms that you had when you were a long child. You could have fallen off the bicycle and hurt your arm real bad, never healed because you were too acidic then. And then when you detox now, that pain comes right back. You wonder, why have I got pain in my elbow? And it might have been from an accident you had as a child growing up. That's how wild this is. But once you understand that, you start looking at those things, you go, oh, that's cool, oh, good. And that's a plus sign because your body is walking backwards and healing itself. These are good signs. Medical doctors don't know how to interpret anything like this. And it's unfortunate because it puts them at odds and puts them in the rear of things. And we all need to get on the same page. In today's world, there's no sense in being narcissistic against each other because people are dying right and left, and you don't want to be part of the problem, you want to be part of the fixing. So I say this for the mother. I'm on a long fast, and if you're breastfeeding, you want to STOP now and get on a fruit and berry and melon diet on the 7-month-old, and also for the mother themselves. You really want to start getting this mucus stuff out of the throat, and it's easy to hawk up right here and clean the voice box, clean all this out, and you got to do it to get that out of the throat area, because what they do to your throat. I don't know if any of you have seen what they do to throat cancers and stuff, but it isn't too pretty, that's for sure. Did you see this? The real reason wheat is toxic? You know, I was raised in farms. My aunts and uncles, but, you know, my uncles basically, they all had farms. So if you stay overnight with cousins and stuff, you're staying on farms. We had 2 big farms that we didn't live on them, thank God. We lived on a big piece of property with horses, but our farms were being ran by somebody that shared crops, you know. But we had to build all the barns and fences, and we had our own stuff there too, like probably 200 acres of Christmas trees. Yuck, yuck, yuck. Hardest work there is Christmas trees. Probably nowadays they have nice machines, but not back then. Try throwing in the dead of winter ice and everything, snow all over these trees. Try huffing them up on top of a big wagon like a hay wagon. Oh, Jesus Christ! I was pretty fit back then. But this individual brought out the fact that, of course, Monsanto, the lovely people of the what do they call it? Roundup. You know, they're using Roundup. I didn't know that the farmers were spraying their fields with Roundup a few days before they harvest. That way they can harvest more wheat because the seeds, the plant gives off, of course, dying and gives off the seeds better. I mean, to put humans through that risk factor, and they're claiming now that the glycophosphate is also showing up in breads and stuff like that. So that's a main ingredient in Roundup is glycophosphate. And, you know, it's supposed to not penetrate the ground. They just lie. It's supposed to not penetrate the ground. It's supposed to just be on the leaves, so it suffocates the leaves from photosynthesis, therefore it kills the roots, blah, 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 blah. But these are classic liars. These are part of the problems. Monsanto's always been part of the problem of this planet, never part of the solution. You know, just all about money, money, money. Who cares about people's health? And it's like, oh, really? We can't have that kind of thinking anymore out there. That's the old days when man wasn't very evolved. And we still think that way? No! So it's a pretty Who wrote this? I think it was, this is by Sarah, the Healthy Home Economist. I think they did a good job, Sarah. I mean, I thought, I had no idea they were doing that, and that's like bad stuff, brother. And remember, this is how they get by with getting some of these things approved. Minute amounts of it. Minute amounts of glycophosphate or whatever chemical you're talking about. Here's the problemo. Accumulation. Accumulation of a continued ingested chemical is very obvious. And particularly when you're not moving what? The lymphatic system. Remember, the blood, it cleans itself into the lymph system. Where? Spleen and kidneys, basically. So the blood is dumping what it don't want, but who's faced with it? The sewer system, the lymphatic system is burdened with all this. Why it's so big and why it has major eliminative organs hooked to it. Look at the GI tract, and it's as eliminative hole out the rectum. And you've got kidneys too, skin. Look at how big the skin is. So you got a lot of elimination dealing with the lymphatic system, and still we get a cationic environment. Still we get coagulation. Hi, my name is Minnie. I am a 61-year-old female, 200 pounds, 5'8". A little bit overweight there, with lots of health issues from eating the toxic average Western diet.
Well, yes.
Yeah. I've developed a bad pain under my right rib area. Both front and back. Let me see. Liver, gallbladder? Ugh. So it could be the gallbladder there. One of the two, more than likely. It could be the colon, but generally when it drives through the back, it's the liver, gallbladder. Could have some stones or something and a fatty liver going on there. Let's see what she comes up with here. Rib area from front back, which one day 2 years ago turned into some kind of attack. Oh, wow. Probably heavy spasming, Anything like that can spasm tissue and spasm heavy pain and spasticity. Hate that. But keep that antispasmodic around the house and just put that under your tongue real quick, and that'll help relieve the spasms of that tissue. But acids deteriorate and spasm tissue, rip the calcium out of tissue and make it spastic. No, the pain went through my entire torso, front and back, then between my shoulder blades, where it felt like I was stabbed with a jagged knife, and I struggled to breathe while I ended up passing out for 3 hours. Holy crap. Ooh, we must be in the stomach area now. Something like that. Holy crap, that's the head, the seat, the brain of the autonomic nervous system. That's your breathing mechanisms. Let's see. Eventually I went to my doctor, you think? She thought it was my gallbladder. That's what I would have thought. But then when you passed out with that, I have to think maybe more stomach, solar plexus, colon or something. Let's take a look here. And she thought it was my gallbladder. She did an ultrasound and a HIDA scan, but both tests came back nothing wrong with the gallbladder. However, that test doesn't show extreme acidosis interstitially. And it doesn't show the genetic weakness of the cells where that's happening. So, absolutely. You don't have to show a stone. You don't have to show a tumor or a cyst. You could just be highly acidic, not show up on an x-ray, maybe a thickened wall a little bit. You'd have to read and see if they pick that up at all. If you had a thickened wall of the gallbladder or liver, of course, then you know immediately. Any time that's thickened, it's a lymph stagnation, big time. Well, that's acids, and that's deterioration and pain and all that sort of thing. All right, so it came back with nothing with the gallbladder. She told me we had to remove my gallbladder anyhow. Oh, okay. Well, there's nothing wrong with your gallbladder, but we got to take it out anyway. I got to buy my new car here next week. I shouldn't have said that. Damn. I asked if it could be my liver, but she refused to consider it to be anything else. She didn't do blood work, because I'm telling you, that much pain, your liver enzymes or alkaline phosphatase should be elevated. And you should put a blood test before just doing an ultrasound and taking a look at that. I'm sure she did. She said she'd have the doctor removing the gallbladder, look around. Oh, while she's removing the gallbladder, we'll just look around, see what else. But you got to cut the liver. We can cut the liver open, see what's in that. Yeah, let's do that. Remove the gallbladder. She looked around, and while she was in there to see if he could find anything else. that, I can't think of going under the knife in a more scarier situation than that. I don't know, we'll look around and see what we can find. And we're going to remove the gallbladder, even though I don't see anything wrong with it, it's still got to be part of the problem. I don't think anything else. See, that's the value of a little science that they discovered back in 1853. What was it? Iridology. A science that a surgeon discovered that has made all the difference in the world in seeing into soft tissue. They don't have anything. And yet they discovered something they couldn't hold on to because they didn't have the awareness to hold on to it. Yeah, that's pretty good. So I just shook my head, no, thank God. Oh, God, I thought you were going to do this. And walked out of her office. I've never drank or smoked or did drugs or other than diet issues. I have no idea what it is. We didn't have to do that. Because I want you to stop and remember, guys, when you're not filtering the side of chemistry, the lymphatic system from the kidneys, and you're not sweating well, the side of the body that deals with the removal of systemic acids. All right? What am I creating here? Lactic acid, right? Lactic acid. I'm also increasing inhalation, right? I'm increasing oxygenation, so I'm increasing carbon usage. I'm going to increase maybe the breakdown of glycogen a little bit, give me a little more glucose. I'm going to, so I'm going to see chemical residues in all the processes in activity increase from just normal sitting and breathing. Because I'm active. I'm obviously increasing the demand for energy, sugars, everything else in the body. When I do that, I am going to be creating chemical residues from the burning of these fuels, just like we do in our car. We have an exhaust system to get rid of that. And we have an exhaust system in the human body called the great lymphatic system. And if they don't understand that, that's a huge disadvantage, because when you understand it, you understand why man suffers from everything. It's that magic golden area that man just never looked at, never thought anything about it much. Some have thought about it. There is a society of lymphologists, but you don't hear a thing from them. So that's the thing. The iridology is where you want to look. If you haven't found your problem yet, you want to pull your eyes out. You'll see them there, because that's the science to see these sort of things. Now, when I eat fruit and veggies and no protein, the pain will be less, but not go away. Well, so what does that tell you? Don't eat protein. Well, that also shows you that protein is, the acid is the problem. When you have more acid in your diet, it kicks up the pain. Well, of course, but that's chemotherapy. That's only medical doctors do stupid things like that, acid on top of acid. See, that's what we have to learn. What you don't do when you're in pain and suffering is you don't consume proteins. It's acid-forming foods. When you have acid-forming foods and you're in pain, which is under the acid sky, you're adding more acids to already an acid environment. Where's the logic in that? There is none. And oncologists can't explain it. And where there's crimes going on in our government right now, there's crimes in the medical community, and no one is holding anybody to task for this, because we assume they're a life-saving group. They're not. They're a life-killing group. You want life-saving group, go to the naturopaths that understand naturopathy, at least to some degree. Naturopathic physicians are as lost as medical doctors now. These schools are not teaching them crap because they don't know. Hell, to have a school to teach health and healing and you don't know anything about it yourself, that's amazing to me. 2 weeks ago, I found your videos on YouTube. Hip, hip, hooray. Yoo! I've been eating all fruit for about the whole 2 weeks. Grapes, watermelon, cantaloupe, but kidneys not filtering yet. See what I'm saying? Get those kidneys filtering. Try 24-hour, 36-hour dry fast and see if you can't shake that loose. 2 kidney formulas, maybe even a kidney blender for 1 bottle to go, hey, wake up there, babies. Try that, but always go after those adrenal glands. They turn on the kidneys too, so go after the adrenals. They're brother and sister, man and wife, however you reach. Look at it. I've ordered your kidney 1 and 2 and your adrenal. There you go. Oh, I forgot. Also, my doctor told me not to be eating fruit. Oh, crap. No, don't eat any fruit now. I've given myself a stroke since my cholesterol is 259. Give yourself a stroke eating fruit? That's the only food that will remove the cholesterol. That's the only food that will remove it, my dear one. This is ridiculous. You know, that is such a stupid statement. I love these medical doctors that make statements totally out of context, totally from uneducated unawareness, and like they know the answer. Oh, please. That's the problem. People just need to get smart about this. Oh, look at that. Give yourself a stroke. Matter of fact, you'll give yourself a stroke if you don't. You know, when you start to see your cholesterol's going up, you have to assume you're too acidic and you're starting to plaque it. That's not a bad assumption, because that means you're going to put yourself on a fruit, berry, and melon diet, and you're going after what system? Cholesterol doesn't plaque in an alkaline system because it's base too. You don't get base plaquing on base. That's ridiculous. Where you get it, and you look at Lipitor commercial, it'll show you. The Lipitor people are smart. They know exactly where the cholesterol is plaquing, and it's not on the wall, it's in the wall. Big difference between on and in, isn't it? Different words meaning different things, doesn't it? On versus in, big difference. And it's in the wall, and the lymph system is the only system that can remove it. That's swelling up the vascular wall. So that's what has to come out of there, and the lymphatic system is what you're dealing with, and that is the acid system. It all just fits like a good hand in a fine glove. That's simple. You don't have to go to years of school and beat yourself up in mystery. But you want that fruit to get this cholesterol down, triglycerides and stuff. That's just showing you're acidic, dear one. But it also showing that your adrenal steroids are low. You know, you're going to see some low upper blood pressure number probably. You know, just as the cortex goes, the medulla goes a lot of times. She gave me some anti-cholesterol to take, but it makes me dizzy. Oh, you know what? You don't want to take. My opinion is I wouldn't take anything for anything unless I was dying, because there's so much adverse side effects to these chemicals. And you're hurting yourself more. You know, that's the sad thing. Here's something that'll help you, but it actually kills you. I mean, that's what these commercials say. Here's something that you think you might need and probably will need. Ask your doctor. Oh yeah, ask your pharmaceutical pusher about it, but it could cause your death. But you know, you still could use it. What? Stupid. But we're so dumbed down that people are accepting those commercials and laughing. Oh yeah, it could cause death, but you know, I could maybe use that. Holy moly. I'm so miserable with my health problems, I'm game to keep trying fruit. I would live on it. I would do myself a grape diet for a good 10, 20 days. I really would. You know, and really just start pulling this acid out of here and getting this pain out of there, because it's either liver, gallbladder, stomach, or colon. That's all right, and you can pick either one of those. The stomach area, though, that's your autonomic nervous system. That could affect the pain right up the spine. But remember, your nervous system to the liver gallbladder comes right on the spine as well and can reflect right up the spine as well. So your eyes is probably going to be the story. You might want to send us a picture of your eyes and let me look at that and make note who you are here. And let's show everybody what your eyes look like, and we'll show you right where your problem is. That'd be a good thing to do. So let's do that. If you can do that, send me a picture of your eyeball, Rooskies. Meanwhile, the other day, while out and about all day, my husband bought me a hamburger. Thank you, hubby. Yeah, And like a true idiot, I ate it. Oh, I bet that hurt. That gotta hurt. Yeah, well, but this is how you learn. I can't wait to read this next thing. Oh, yeah. The next day, I woke up with the worst pain I've ever had in my abdomen. Yep. Remember, I told you guys, you don't do protein and pain. I proved that to so many people, including medical doctors, that I'm surprised that, you know, the medical doctors still recommend high protein. Look at these nature paths recommending high protein diet. And this junior nature path out west come down on us. Are you serious? That took a lot of balls for him to do that. This kid doesn't have any brains in terms of being able to figure out what health is and how to help people, and yet he was amazing. And when you go after Pat, you got to have a lot of cojones. That's all I got to say. A lot of cojones. As the day went on, it concentrated to my left back kidney area. Yeah, well, that's probably the kidney where you're having the filtration problem the most, and so that kidney is going to go down. And that's, of course, on the liver gallbladder side. So, you know, the right side here, honey. area and my left front abdomen. So I assumed it was a kidney stone. Possible. After all day excruciating pain, I gave in and went to the ER in case I had a stone too big to pass. Yeah, that'd be a good idea. It doesn't. I love emergency rooms. If they've just had a little higher consciousness to them, and it'd be sweet places to go because put their arms around you here, let me help you, let me stabilize you, let me help you with the pain and all that. I love it. I spent years in emergency rooms. Yeah, we can improve them, but we still have some top emergency medicine in the world, but we don't in burns. Burns is American medical doctors have no clue how to treat wounds, burns I mean, or even wounds really, how to accelerate the healing of the body, things like that. See, when you're down with heart attacks or wounds or burns, we know how to accelerate that healing and get you through these things. So you need a true naturopathist on board in all ERs and all ICUs and everywhere else. You should have one in the kitchen overseeing should I say the dietitian? All right. So you went to the ER. They did a CAT scan and didn't find a stone, but said I had acute, whatever that is. They gave me an antibiotic by IV and some kind of painkiller, which nauseated me. They sent me home with an antibiotic and painkiller as well. Today, one day later, my kidneys don't hurt, but my entire abdomen is in excruciating pain again. Yeah, you have extreme acidosis there. And you have so much of this pain, you could be getting some breakdown, some degeneration there. You really need to send me your eyes, and let's get this dealt with really quick. But you got to focus on your kidneys, your adrenal glands. You can use some antacids there. We've got a joint inflammation joint formula. That's great as an antacid. Slippery elm, marshmallow, great. The stomach tea, great antacid. Cools everything down. Stay away from protein or even complex. I stay away from vegetables. A little more complex amino acids than fruits and anything like that. It's an alkaline hit. But anytime you consume an acid ash food, dear, you're going to have pain. As you begin to get your alkaline ash food, just what we talked about earlier, it's going to pull that pain out of there because it's neutralizing the acids. It's just all chemistry. That's all it is. And learning that, then he said, oh, I understand. It's not real easy to understand. And then you're not living in the mystery world of fear and stuff. But that your eyes will have it. Today, one day after my kidneys didn't hurt, but called the doctor just now, and she's changing my antibiotic from Ciprofloxacin to sulfafame. Oh, here's a sulfa drug right here. It even spells it right out. Are you going to do a sulfa drug? I'd rethink that. Instead of taking it, I went and bought a probiotic thinking might be a severe abdominal pain and from my first eating fruit for 2 weeks, then putting that stupid toxic hamburger in my gut. That's how you learn, which now I've caused abdominal distress and maybe these antibiotics are killing my good bacteria. Of course they are. It is not a bacterial problem that you're having. You're having an acid problem. Bacteria isn't the problem. It's your acids that's the problem. If bacteria is after anything, they're after your protein, your acids. That's what they're after. They're not after your healthy tissue or anything. They don't get that. I don't know what their problem is. Yeah, you could have a raging bull because you have a lot of lymph stagnation, so that's the other problem with bacteria. They're just hungry little fellas. Okay, what do you think? I'm just trying to rough it out with this pain, but it's too bad. I wouldn't rough it out with pain. I'm assuming I've got... Anyhow, I'm so lucky to have found you. Okay, I don't have a telephone number here to call you, or we could call you right here in front of the whole group. You guys like that? I call this lady up, and we'll find out what's wrong, but I don't have a telephone number. She lives in Michigan. But I'm on 100% fruit, berry, and melon, and I would say this. I'd stay away from the high astringent fruit just for a little while. You might even want to add some green drinks. Cool, settle everybody down. I'd be on my kidney formulas, 2 of them. I'd be on 1 lymphatic 1, and I'd probably do the lymphatic 1 capsule. Then I'm on a stomach and bowel formula, probably number 1. If you're moving your bowels every day, that'll cool everything down. I might be sipping on on stomach tea or something just to cool everything down with marshmallow and slippery elm, just to cool all these acids down. I'm on a liver gallbladder formula, no question. I'm on a Parasite M. I'd be starting the 2-week detox program. That'll kill any worms you might have. You could have liver full of flukes or pancreas full of flukes. You don't know. Go in that direction, cooling everything down. And keeping like applesauce with cinnamon in there. Eat light like that. Do a lot of your digesting in your mouth. So do Red Delicious, so it's nice and sweet on you, a little cinnamon, and do a lot of that. Let that apple start healing. Apples are great at detoxing gallstones, and if they didn't see any gallstones, then it's interstitial. If they didn't see anything with the scans, it's interstitial, and that's the worst place. It's hands down lymphatic. So that can chew you before they find out. You can be chewed up. Serious problems. Serious problems. They're moving into the cancer side. You can only handle that much chew on the body that so long, and then the cells are going to convert. I mean, that's obvious. So it's just the natural process. You have to reverse that, and you're doing right with your thinking and putting yourself on fruit. You got to get this cholesterol, but the cholesterol is showing that you do have acidosis big time, and that you're fighting that, and probably some poor circulation. So just to be sure, don't have your eyes or anything. If it was me, I'm putting myself on upper brain and nerve, and lower circulation. If you can't afford both of those three, then leave off the brain and nerve and do upper circ and lower circulation. The brain and nerve will strengthen the myelin sheath in the nervous system to help with the pain a little bit. But acidosis is the problem here. And so you got to rectify that. And it's easy to determine that with all the tests, and they didn't see these things. Yep. And that they don't get interstitial acidosis. Because they don't get interstitial. And it's amazing. They should. Big part of training. Okay, Mike. Mike, my wife and I have been detoxing with fruit diet for about 5 months. And I have taken many of your herbal products. I have had very positive results, including a dynamic decrease in insulin, which I need to take. I'm a type 1 diabetic, but my wife has had a major issue with unbearable itchy skin. Which is driving her nuts. Yeah, I know it. My God, this is one of the bad things about detox is right here. This poor lady, and has also developed dark blotches all over her body, which is very scary. Can you please address these issues in your videos? Please explain why this is happening and what she can do to relieve the itchiness and get rid of the dark blotches. Many thanks. And this is Mike from Montreal. Yeah, I feel sorry for her. She's probably fungal head to toe. We've had a lot of people. I had a poor fireman. She was a female fireman down the way, and oh my God, she just had to itch her skin almost raw. There are anti-itch soaps out there. We sell some in the store here, pharmacy. But go out Parasite M. I'd hit Parasite M. As a matter of fact, I do Parasite M and Parasite G. I'd probably do Parasite G for 4 capsules, 4 times a day for a couple of bottles, and I would do probably 2 months of Parasite M, a dropper and a half to 2 dropper fulls 4 times a day. And she just got a lot of fungus. And it's just itch. It wouldn't hurt her to use the brain and nerve to kind of help that, the nerve endings and stuff a little bit, because she's going to irritate these real bad. And I know the problem. You'll itch your skin raw, but it's just high fungus in the body. High fungus in the body with high lymph stagnation too. So she has a lot of lymphatic issues to go through here. And if she has any moles growing on her and fungus, it just shows to verify that, like fungal toes or fingernails. Moles growing on your body is another good example. Warts. All of these are high fungal problems in the body, showing that sugar metabolism is off, like yours even, with type 1. Go after those beta cells. And with you, remember this, Mike, that there is neurological type 1, so take brain and nerve as well. Always go after the adrenal glands associated with that type 1, even though we're talking about loosely the beta cells, the islets of Langerhans, right? But remember I told you about a type 1 I had from 4th surgery. She went into type 1, wasn't before. Neurological type 1. We got the nervous system back up, no more type 1. So there's that. There's also liver or pancreatic flukes. So always clean the body of parasites and flukes and everything else, because I've seen type 1s with pancreatic flukes. So take care of the flukes if there's any there. And at the same time, keep yourself on a fructose as opposed to glucose diet as much as possible. And you just do the much as possible. Here's another thing I thought of. I was going to talk to Marcy about this, and some of you brittles. And I don't know how much this can affect this, but what about veggie caps? I'm thinking, because we use a lot of capsules, I like raw herbs as opposed to tinctures, but tinctures are so easy and so nice and packed the way we do them. But capsules, we use veggie caps. That's starch. So that's glucose. So if a person was taking a lot of vegetable capsules, that might affect your blood sugar as well. I mean, I just happened to think of this the other day because I hadn't thought about that before. And it's like, what? If that's the case, then you have to move away from the veggie caps. I mean, it's always something. I don't know if that's the case, though. But it would sound like it to me. If I was just staying on the fruit level, I could deal with that. But I don't know what if the veggie caps throw me into more glucose. I don't know. Just throwing that out to you, Mike. Just throwing that out to you. I'm going to talk to Marcy about that. I just forgot to do that before. But as far as your wife with the blotches, she could have all kinds of things. She could have eczema or psoriasis pop out all over the place just because the skin is your largest eliminative organ. If I was her, make sure her thyroid is up, her underarm basal temperatures are upper 97s, 98. Sweat. I'd find me. You know, these little steam saunas you can buy online in places are only like $1,300, $1,500. You can put like essential oils like lemon, and it really kind of help and aid the detox and the movement up through the skin. So, you know, doing that, I am adamantly opposed to far infrared. But a steam sauna like that would be excellent. And you could use distilled water for it or something, you know, RO water or something. Or just good mineral water. With that said, use the skin formula, hit the kidneys hard, because what's happening here is that her skin probably subcutaneously has been backing up as well. If you look at her eye, see if she has a skin ring around the outside of the eye, that's a darker ring around the outside of her eye, that means she skin's even weak genetically. And see if there's thick lymph building up around that skin. Also kidney filtration, her one big relief is to go after kidney filtration and start pulling this as much as she can through the kidneys instead of going through the skin. Very important to hit her adrenals and kidneys, make sure she's filtering, look at the urine, and going after filtration. It's when people are locked in like that the microbes are just, you know, you're a sewage place. You just become a sewage dump inside, so you expect a heavy fungal and bacterium. That's their job. But then, you know, when you open the doors, everything's going to want to come out, and, you know, you got all kinds of problems, so I feel for her. But there's anti-itch soaps and stuff. Chickweed, I think, is anti-itch, too. So you can try a little chickweed tea, but also go after the fungus in the body and go after kidney and adrenal gland and kidney filtration. That'd be where I'd go. Sometimes we have to open some doors there. Okay, let's see here. Please read and reply. I would love to hear you speak to me. All right. Who is this? 20 years old, South Florida. On a 80-20 diet, organic fruits and whatever else I want. No tinctures right now. Feeling great, however, have weakness. Oh, this is Kendrick Ramirez. Oh, look at this. All right, so you got sneezing. What's sneezing for anyway? When you're sneezing, what's sneezing? And you're trying to pull, right? What are you trying to pull? Basically, mucus plugs. Trying to pull and break loose the mucus. And you can pull and break it loose in the throat. So when you're sneezing, that means you're loaded here. You're backed up in the sinuses and your body's trying to break it loose. Eat something sweet and look up at the sun. That can make you sneeze, and that's a tall tale of high fungus in the body. Mucus around eyes sometimes, yeah. It's like I'm saying, you're full of mucus up here and it just needs to come out. And you use the eye wash and you'll find mucus just pouring out of the eyes too. And that helps you to see too, so the eye wash is good at pulling mucus out of your eyes. I get about 12 drops in an eye cup, wash my eyes out morning and night. Really helps to inspire blood and lymph flow in the eye tissue. I would, especially if you have pressure in the eyes like glaucoma and stuff like this. Have went down after taking upper circulation tincture. But you want that mucus to come out. Come on out, baby, because that's what's suppressive in the body. Imagine if the mucus that you see coming out is locked in you. What's it locked around? Where's it at? Around your cells, interstitially. Not good. Having had lots of hair loss and receding hairline, but has slowed down after eating better and reducing stress with personal development. Excellent. Now, you want to stay on upper circulation to get new hair follicles growing, but you also want to remove the mucus and acid out of the head, that which is taking it off. See, you want to fix that which is causing the problem and then inspire new growth and tissue. You know, it's just like clean and strengthen, the two great words of health. Clean and strengthen thy physical body. Yes. Had elbow surgery in December 2016, removing a cyst and bone growth in previous injury when I was in 4th grade. So what that does tell you, though, your lymph system is not moving well since you were in the 4th grade, and that trauma didn't really heal properly. So in a deeper detox, you might feel something with that. You never know. That's real possible. But that just goes to show you that it never healed. And then you had the surgery. So you might have some symptoms here in detox. And I would expect that, to be honest with you. Had knee surgery in March 2017, ACL restriction and partial meniscus tear, which was put back together. Now, you know what? Keep words popping in my mind, guys. What's popping in your mind? I'm thinking so. Parathyroid. Man, that parathyroid keeps popping in my mind, so you might want to take a look at your eyes. You might want to do a round of a parathyroid glandular 2-3 times a day if it was me, and I'd probably give myself a little pituitary bump too, not knowing whether you have a pituitary or not. But if I took a picture of my eyes and I've got enough stuff on the YouTube to read it, I might be looking at that going, oh, look. But you want to go after your parathyroid, and I would also bump the pituitary up with herbs. And try to strengthen connective tissue and skeletal tissue, just because you're getting a little history here. In these, sometimes a small accident can have deeper effects than it should have and should heal. You break your bones or tear yourself up, your body's designed to heal itself. When it doesn't, or it's real slow to heal, what's up? Acidosis. That's what's up. And another word for that is lymph stagnation. And another word for that is a lack of kidney and skin filtration. Now, found out about Kevin Trudeau and read Natural Cures they don't want you to know about, and then found out about you through a friend and saw your Great Lymphatic System video and loved it. Love you. Thank you. Oh, Kevin Trudeau. That guy's been up and down. Because I was already conscious to what is going on and was taking biology. Oh, I love biology. I've had a little biology in my world, but I wanted more botany. I really like botany, but I only had a minimal amount of botany in my life, and very few people never talk about botany. And I love botany. That's the study of plants. The leaf design, the stem design, the whole 9 yards. Fun stuff. I think these courses should be fun and hooked to herbal courses, and these local universities set up some nice herb courses and stuff so people can learn the true healing power of nature. Come on in. You know what? I'm glad you're here because I was just talking to a type 1 Mike here. And you know what I was thinking the other night? Come on in here. They don't probably know you, but come on in anyway.
Hello.
I was thinking in type 1. All right. Capsules. Veggie capsules. Starch. Glucose. What if one was taking too many glucose capsules in a type 1, trying to control it with fruit, which is trying to work with fruit, controlling blood sugar. But if you took too many capsules, I wonder how that would affect the glucose.
Well, that's like the glycerins. If I'm working with a diabetic, I tend to not put glycerin.
That would make total sense to me.
Yeah.
Total sense to me, not the glycerin.
And we try and, especially things like pancreas, liquid all the way.
Yeah. So I wanted to mention that because I was talking to him about that, and I was thinking the other day, because if a thought comes in, you got to look at that. I'm thinking maybe we better look a little closer at recommending capsules and glycerins, because I don't recommend glycerins in any diet, but still I'm recommending capsules. So I don't know. Whatever you guys think.
Yep.
What's up, my dear one?
Good question. I just don't ever see you anymore.
Where are you?
I forgot that you were in here in a session. I shouldn't have peeked my head in.
Yeah. I've been trying to catch up with the class.
Yeah.
I still have, guys, I'm almost done with you. I've got 2 and probably a dozen charts out in the truck that is left from the class out of 80 some.
Yeah.
Almost 90 charts.
I'm sitting there and I'm in a session with someone and I hear Robert's voice and I'm like, oh, I want to go say hi. So, but it's we're busy. We're actually swamped right now.
Look at this.
So,
We are so swamped. Look at this one. The mother has stage 4 tonsil cancer, but her daughter, my 17-month-old granddaughter has a condition called SOD, right? She was born without a pituitary gland.
so all of our other organs are working overtime to make up for that.
Yeah, and I was talking to him
Think
about the thymus.
hypothalamus.
Yeah, the hypothalamus and the thymus gland. Whether she has even, what about that one?
Yeah.
And so we need to look at the T cells and maybe inspire thymus a little bit. But, hit a pituitary glandular a little bit on this girl, upper circulation, brain
Absolutely.
and nerve, and a pituitary glandular. And I bet you a bottom dollar, being 17 months, we can get a new pituitary gland going.
First of all, is it no pituitary or is it a atrophied one?
Right. That's what we need to know. If there's even a little stem cell or a little bump of one,
Absolutely.
that would be so cool, wouldn't it? Talk
Absolutely.
about amazing. But we've done that with thyroids, remember. We haven't done it with the pituitary. That would be, ooh.
Well, think about it. You got a couple of assistants, and one day one of them's homesick. Well, what's that create on the rest of the staff?
Yeah.
More work.
More work.
And so you know that your body's working extra hard to do the things that the pituitary wouldn't.
And she didn't get much facts, so I asked for eye pics, eye pictures.
Yeah.
17-month-old might be impossible to get an eye picture from her, but boy, if you could have that little handheld.
On a baby, especially if they're a little bit more of a sleeper, not in the middle of the night when you go from dark everywhere to flashing light, but maybe during the daytime while they're taking a nap, if you can gently pry that eye open and just see what you can do. Some babies are light sleepers, but
if you could just get a little bit of a picture there, we could just see something.
I just want you guys to understand the seriousness of what an eye picture shows to us when we are trying to work with you and figure this out, and to you guys. I just had a lady where the eyes, you have to look and look, but you can see the good genes underneath.
Oh, wow.
But you can see the nerve rings that are coming. So as she starts clearing this lymph out, those nerve rings are going to appear. And I've had some people say, well, my eyes look worse.
Yeah.
Sometimes they can before they get better because you're showing what's underneath.
Absolutely, too. And a good point of that one was, well, there's one that I'm reading now, but this one here, there's the one with the wife, she talks itching all over like crazy. I feel sorry for them. But she's got pain they can't find. It's a pain that burns through from what would be the liver gallbladder area to the back. So, her MD, she finally went to them thinking it could have been liver gallbladder and stuff, and so she went to her medical doctor, and the medical doctor took an ultrasound and stuff and said, well, I don't see any stones or anything. She said, but I need to remove it anyway. So she needed to remove it anyway, and then while they're in there, they'll look around and see what they can see.
Yeah.
That gets me, because if you can't see anything from an ultrasound, what are you going to see from naked eyes?
Yeah.
And the issue is that it could be the stomach and stuff, but she did have a case where the pain started resonating up her spine, and she went unconscious for 3 hours. So we're either stomach, brain, autonomic brain.
Yep.
We're either at a gallbladder. They thought it was a kidney stone, no kidney stones. But what they don't see is where? Interstitial. They don't see in the wall of these tissues and the burning of the acids from the wall. They're not going to see that. And she didn't mention thickening of the wall, but then we haven't read any tests from them.
So far, every person that I've seen with even anything in their eye, in the liver area, I ask them, how hard is it for you to let go of anger? That might be another thing. That anger can bring an acidic pain.
Well, she didn't say too much about that on her case, but we'll see.
I had a guy yesterday, went in for hernia surgery. The doctor accidentally nicked the spleen, couldn't get it to stop bleeding, removed it. What did he say? Well, you didn't need that anyway.
Are you serious?
You can survive without that.
Are you serious? He nipped the spleen, couldn't get it to stop, and he cut it out anyway?
Yep.
Holy crap.
Yep.
That's what I'm saying. I love good surgeons, but there's some strange ones out there. To remove the spleen, how does your blood clean itself anymore, and then you're going to have a problem in a little white blood cell. Even though the lungs, they know now, produce the platelet, the spleen is the distributor. The spleen is the distributor. That's where I was just talking about the spleen and how it refurbishes the blood cells, and it cleans the lymph. It cleans the blood into the lymph. The lymph is the one that gets beat up.
Absolutely.
You know, and then now you don't have a way to clean that, and it's like you just rely on the kidney. I mean, it's a mess.
Yeah.
Yeah. You don't need it anyway. I love that one. Hell, you don't need those eyeballs. Let me take them out. You don't need that heart. I mean, it's like, I don't know where these guys come up with.
Well, we need to figure out something that we create, maybe a sheet that we lay over the body so that when the doctors go in to remove something, what was that game, Operation, where if it got too
really?
close?
Oh, I know it. I've seen surgeons play that game, and especially the plastic surgeons on TV, botched. These guys are funny stuff, but they are super good surgeons.
Yeah.
They've got that game and they'll play. Oh, it's a funny game.
Yeah.
Let me see what's going on here with this one. She wants me to read and reply to her. She said, I'm excited about life. I'm very concerned for my friends and family. I try to tell them about you and send them your videos on lymphatic system. I'm 20 years old. Wow. Mm-hmm. Young girl, and I was told about you by my business partner. I really would want to go to see you and get my eyes checked out. I have had elbow surgery and knee surgery in the past year. I just went over a knee and elbow. I believe with regeneration I can't even get stronger. You betcha. I have been eating lots of fruit and organic. However, it's difficult because I want to know what fruits are really necessary, and I want to know what fruits do what and how much fruit you should eat to feed all these cells. Oh, also with the herbs, is the Fab 4 somewhere I should start? I eat fruits maybe 80% or more of my daily diet. However, I eat some chicken, fries, sandwiches. Well, that's a pretty good balance. Oh my God, honey. Yeah, I think you had better get rid of the chicken, fries, and sandwiches just for a little while. Go gangbusters. I have eye problems, I know it, and my kidneys are not filtering. I have dark under my eyes. I am balding heavily. Is this a female or a male?
I don't see.
Oh, it's Kendrick.
Okay,
it's
so a male.
Yep, it's a male. I have dark eyes. Yeah, I'm balding heavily. That's 20 years old and you're balding, my friend. Remember, we just talked about this on a case or two back. High acidosis in the head. Mm-hmm. Oh my God! I go to the sauna for 20 plus minutes. That's good. I'm trying to be in Wellville and be a Jedi. Yeah, you know, believe it or not, I see all you guys as Jedis. I do. You know what? It takes a lot to stand up against the power of the day, the world bankers, this big negative, and not just them, the negative forces themselves. Stand up against the negative side of God and say, you know what? I represent the light, and nothing you're going to do is going to shake me from that. And be strong that way, you know, because that's what we're battling is the negative forces here.
Love yourself and believe in yourself enough to be courageous is what Natanya and I were just talking about.
I love that. It is so true, too. She's good, too, you know.
Yeah.
Especially about entities. I love that. A lot of people deal with these. I have much belief in the truth you speak. Look forward to hearing from you. Well, my man, and here's some of the things he does. No tinctures right now. Feeling great, however, have weaknesses.
So let me just take this marijuana smoking here for a second. There have been so many things proving the healing benefits of marijuana. But again, the negative always wants to bring a counterpart to that.
Yeah.
Try to figure out a way to vaporize it or to get it, do the oil or to do something besides smoking it because that smoke is acidic. So in essence, you're trying to take something that's healing and you're turning it into something that's actually against the body. So really try and look at different avenues of how to internalize that and get that in besides the actual smoking of that.
Yeah. You know, in herbology, they recommend smoking mullein as an anti-inflammatory to the lungs. And it's like, well, the smoke's acidic. What the hell is that? You know, so it's just that unawareness has been passed down through the ages, you know. Yeah. And I see where they're coming from.
Exactly.
My dad blew cigar smoke in my ear when I had ear pain, thinking it would help. And it's like, nobody knowing the truth of this.
Well, he was just candling you without the candle.
I know, it was. You know, it's like, and What if they had ear candles and all the earaches people have, and they just pull that right out of them and help them? We need help on this planet in our healing arts, and the Jedis are the ones that are here to do that.
Yep.
And this is one of them. Cool stuff, man. What do we got else going on? Lots of hair loss, receding hairline. That's not good. Upper circuit, brain and nerve, and drain the sinuses, get the bowels taken care of, get the kidneys to filter. And
Mucus around the eyes and
yeah,
stuff.
yeah.
This is just all...
Yeah, I wash it out, pull it out.
Yep.
Yeah, head's full of mucus. The question was sneezing.
Yeah.
Well, he's sneezing because his head's full of mucus and the body trying to break this loose and get this out.
Yep.
Isn't that amazing?
Yep.
He had elbow and knee surgery. I just read another one that had elbow and knee surgery in March. Oh, this is the same one. This is the same one. Mm-hmm. And so I'm thinking parathyroid here as well.
Yeah.
They had the knee and the arm, and so you got to start thinking, there's something going on here.
Yeah.
I'm getting easy tears, and fractures and stuff. So look at the parathyroid, pituitary area, that sort of thing.
I've really been bombarded lately with young people and people who are still on this journey, haven't seen a lot of healing yet, but they're working on it, they have faith in it, and they're trying to tell their family about it, and the family is just, they don't want to hear it, they're jeering and stuff. Be patient with them. It's one of these things where, just keep planting those seeds. Eventually one day they're going to come around, whether that's because they develop something major and they don't have a choice, or whether they see the benefits and the changes of your testimony. It will come, but the more you push it, the further out you will extend them paying attention and listening.
I just had the image when you were saying that, up at the pearly gates, St. Pete, right up at the pearly gates, and you're coming screaming and begging and kicking, it's like, Jesus criminy.
Yeah.
It's like, relax and realize truth is the key, and you always want to live it and seek it. Yep. And it's always question everything. That's the new kind of thing out there, question everything. But you should, to a certain extent, pull back and question it, not from another preconceived idea, but from unperceived ideas. Look at how does these fit, or what or what's being told to you, how does it fit in the scheme of things? Mm-hmm. Does it fit in the truth that you're learning? And just to learn truth, things that you can't verify as truth, don't hang on to it.
And truth is living. It's active. It's
ongoing, breathing. Absolutely.
Ask for truth to be revealed, and it will be.
Yeah, I could see God going, I sent you people to help you with the fruit and everything, kind of like the preacher man out in the woods in the rain, and I sent you all this, and you still, you still want to go get cut up and poison.
Okay, so I have a story to tell you.
Okay, I got it. This is good.
Yesterday I had a lady that was in, yesterday or the day before, and she has been battling with some aggressive breast cancer. And she was going along, has been doing Gerson therapy, and she had somebody ask her, have you ever heard about a Dr. Morse? And a couple of, she didn't pay much attention to it. A couple days later, I think she said it was her chiropractor, said, have you ever heard of a Dr. Morse? She goes, well, wait a minute here. That's the second time. Within 1 week, 3 people asked her if they ever had heard of you. And then in the second week, another one did. So 4.
Look at that.
And it's like, can I have a sign, please?
Yeah, I know. You know what? That's why we're all God people. And you just be the God person you are.
4 different people.
Look at that.
Asking him if she'd heard about you.
Knock on the door.
Yep.
And still, they might not, cause she came though, but still.
Yep.
You still, but you know what? You never know.
Yeah.
They'll work it out.
Yeah.
But it's cool stuff.
It's all in timing. And there's just some people who aren't ready to hear it yet.
Exactly what it is. She just got to get it right, all her ducks in a row on all these levels. We don't see it, we don't understand in her journey what has to be in line for her to be able to walk this way.
Yeah.
So you never know. That's why you don't want to judge anybody.
Exactly.
You young guys and gals, don't judge anybody. You don't need to judge anybody. You have your own world, your own life, and you want to run your own world and be happy in it. Let other people run their own world how they see it. You always want to give truth out, and that way if someone isn't living truth and they see it, they might want to change and start living more truthfully.
Yeah.
Yeah.
And you know what? if you're meeting with people and at this time, you know, they're talking about all the things they're eating that they shouldn't, encourage them to give up some more. And then the next time, they'll have given up a little more and you encourage them to go to the next step. It's one of those things that some people, when it's said it's a journey, journeys are one step at a time. It's not the leaps and the bounds.
Yeah.
I commend the ones that can say, I've got this issue, I found out about Dr. Morse, I am fully raw and I've been fully raw for 6 months.
Yeah.
Go!
Yeah,
Awesome!
yeah, yeah.
But there are people who cannot do that.
Yeah.
And you still have to love them and encourage them
Yeah.
so that they can eventually move in that direction.
Yeah. And it shows you that you're the chosen one. You're the spiritual one that's here with the knowledge and awareness to wake up to that, to put your hand out and help others. Because that's the bottom line, is to show others how we help each other. And it's like this world doesn't seem to be wanting to do a lot of that. So there's so many of you doing it now. And I just think that we're overpowering those negative forces as time's going on here.
Yeah.
And so it's all good stuff.
What does it say? Don't be the light so that people see you. Be the light so that through you people can see. So.
Yeah. Yeah, you want to be, in my opinion, as a God person.
That was a quote I got and I didn't butcher it, I don't
See?
think.
You did
I'm
good.
so excited.
You're good at that, though. Now,
Butchering quotes? Yeah, I know.
No, not butchering quotes. I mean, you've got more stories than... You're like a friend of mine. Always in the toilet, he had a joke book. So he could come off at any time, in any place, with a joke or a story or something. It's like, I can never remember those things. You know, it's like... someone say, well, tell me a joke. I'm going, I can't remember. I don't know what that is, you know. But you definitely want people to see the light of God through your beingness.
Absolutely.
You know, that is when you got it, is when they can see the light of God through you, because that's who you are. You know, and so enjoy that. This is from Susanna Elliott. It's kind of a refined name, Susanna Elliott, right? Reminds me of Elliot Gills. Anybody remember him as a star there? It says, Dearest Dr. Robert Morse. Let's see here.
There's a picture there.
Oh, wow, here's a picture here. Oh, I know her. Hey, dear one. Your healing and spiritual teachings have empowered me to transform my life and reclaim my health. My deepest thanks and love to you. Words cannot fully convey the transformation impact your wisdom has had. I thank God. Oh, honey, thank you so much that you have given this gift. Wow, responsibility as your soul's me. Thanks, sweetheart. Thank you, thank you, thank you. Look at this. I am 23 years young, female from England. I remember the moment I was drawn to your first video on everything you need to know about foods. Wow. That's my Christmas, I titled that one. I felt as though I was reconnecting with a dear, beloved friend. You are, don't you think?
Absolutely.
We are all dearly beloved friends.
Absolutely.
I mean, we come from the same source, and we all might have come, some of us might have come together, remember that? I can't stop smiling. Me neither. The above photo was taken the month I graduated and found the truth in your words about health. Yeah. 2017 is the year I decided to take the bull by the horns, take responsibility for myself, and ride the raw fruitarian bull. That's
love
a
that
wild
analogy.
bull. Yeah, I
Absolutely.
do. I do. When I found you 2 years ago, I knew what you said was the truth, but I was not yet fully spiritually nearly ready. And that's what we're talking about. That's okay. It's okay.
Yep.
Because we're all here together anyway, and as we unfold, we become more awakened to each other's love and stuff. Just good stuff. And only became wearing the robe this year. That's okay. Wear it this year, baby. Become the woman warrior of the universe.
Yes.
I have been raw 98% fruit, and over 5 months now, I feel like I am growing sometimes and becoming more connected with God and the all. That's another thing. Oh, we didn't tell them that part of it, did we? That when you start getting that high fruit, you just naturally are polarized to God. You naturally start seeing and experiencing and feeling more of the divine. I mean, I don't know how to say it. It's
Yeah.
true, isn't it?
Yeah.
It is. Whatever word you put on it, it doesn't matter what word you give it. It's that what you feel and what you experience. That's amazing. You can't put words to it.
Yeah.
You can't. It's neat stuff. From the age of 13, look at this. From the age of 13, this poor soul suffered with severe acne on my face, back, and chest. Jiminy Christmas. For 9 years, I was on a constant stream of antibiotics. You know, that's so knowing it doesn't help and it compromises bacterial lymph nodes, why do they do this?
Yeah.
Why do they do this?
Because they don't have another answer.
They don't have another answer. You know, you get snake bit or spider bit, they go after antibiotics again.
Yeah.
And wrong toxins.
Yeah.
And they go after antibiotics again. It's like, and it doesn't help. And oh my God.
Yep.
I know. Where are we? Oh, down here.
Contraceptive
And the contraceptive pill. And I was on Accutane throughout university. I was told by the doctors that food had no impact on my skin. You know, when you get so intellectual that you leave the realm of reality and truth and you're flying somewhere up there in the clouds thinking you're the smartest person in the world.
You're constantly rebuilding cells. Constantly rebuilding cells. Where are you getting that material if not through your food?
Wait a minute. It flies in from Moose Jaw, Alaska. Like diseases. They fly in from Moose Jaw and they go, oh, Marcy, yeah, I like her. I think I'll give her a type 1. What? I mean, that's the kind of consciousness, almost like, oh, your cancer is moving. It's like a creeping crud. It's moving through you. Now it's over
Did
here.
you say creeping Craig?
Yeah.
My husband's name's Craig. How am I telling you?
Not Craig, crud.
Oh, okay, crud. I
Crud, not Craig.
I'm still going to say creeping Craig.
Oh, Craig. Oh, where am I now? Okay, where am I now? Well, without any points of identification, you're in the now. There is no points. Where are you? I know. Let me see, Tommy, there was nothing about diet. Isn't that sickening to your stomach? I felt this to be wrong. Smart woman, very spiritual, but was so desperate and took the. I don't blame her.
Yeah.
You know, when you have that much and you trusted medical community, they generated this pseudo trust out there. It's like, what? You guys don't even know what causes these things, and yet you've initiated trust in yourself. That's ridiculous. We have to break that and learn that's not true. Just for these depressive drugs, I knew this suffering and pain was for soul growth. Wow, she's this aware little kid, right? In the first 2 months of my detoxification, I had the worst blowback of acne on my face. And, you know, I want to give my, I'm sorry about that for myself and for you guys, but there's nothing we can do about it.
Yeah.
When you suppress, the blowback is coming. And it isn't funny. And she's just another one that had the blowback from suppression of steroids and Accutane. And I feel for them. But when you think about all that, yeah, sad stuff. But to see that blowback like that.
Well, I just got an image of a bottle where you put baking soda in it. Have you ever, like when you were a kid, did you ever put baking soda in those plastic 2-liter bottles and shook it up and then put the lid on it, and all of a sudden the pressure behind it just exploded that lid off of there? That's what happens when you suppress, and you finally start moving the system and getting things out, and you're going to have that in a lot of ways, depending on your system and how it functions and stuff. You can't ever suppress. Suppression is...
It's like taking a bunch of wild horses and corralling them like you do out west, and them trying to break the fence down, It's a horrible thing. But you have to live with that. You can use the burn salve. That's another reason we created the burn salve, because this is a burn. These are acids, so it's a burn. So use that burn salve because you don't want to treat it with anything that's not nutritive. And of course, these salves are nutritive as well. They're healing to cells. They're not more suppressive. You don't want more suppressive, and of course they're oil driven. So you've got the grapeseed oils and stuff, which is nutritive and healing, anti-acids and stuff. So that's the best way to enter these realms like that. But I knew that I was shaking the bushel baby. I like her. She's cool. It was simply my body trying to purge the acid lymph waste, and that's what you guys are getting. Smart. And manifested itself through my skin. As well, my eyes are changing color from hazel to, look at that, and to my true blue. She's knocking it out the park.
Absolutely.
Isn't that cool?
Absolutely.
And she's watching her eyes change.
Yep.
Oh, this got to freak them out right there, right? Yeah, I was on raw foods and changed my eye color. That got to freak out most medical doctors right there.
Yeah.
I love it. Good stuff, man. Her eyes pulling on the lymph and drawing the acids out of me. I knew I was cleaning my lymph system and purifying, regenerating my cells. I thank God that it only takes a fraction of the time to undo it that it does to do it. And you're right on with that. Listen, I think the same thing. Thank God it doesn't take the same amount of time to undo those things that we do. Thank you.
Yeah.
Yeah. No kidding. That's a big one we've talked about before, too.
Yep.
My skin is now clearing up beautifully, but beyond that, this change in diet has been an energetic door to my spiritual awakening. I was focused on my skin for so long that I didn't see the spiritual stuff coming. Got her. Yeah, right. I am so blessed and I'm going to become a healer to help others who are in Hellville. My suffering is the foundation for me to help empower. This is a very aware being. I love this. No judgment from me. Sweetheart, our love, I'm telling you, that's a true mark of a high spiritual being. So accept the fact that you are a high spiritual being. You're becoming awake. You're helping others. You're understanding the truth of life. This is the job that we're here to do and help you guys awaken, because we like awakened ourselves. You know, so it's like everybody's working together to help everybody awaken. Absolutely. That's good stuff. The simplicity of health is powerful. What did you see here?
No, I was just saying that next part for her.
No judgment from me. It is just that I have noticed that so many do not want to empower themselves. They're lost. They're so depleted of energy and consciousness and so disempowered by society and churches and family members. Where's our churches to empower us with God? Where's our schools to empower us with knowledge, but also keeping our awareness? Where's our, where is this? It's not there. Where's our spiritual leaders to hook us back to God again and make us happy to enjoy our divine journey?
The problem is most people have gotten to a hopeless state and they don't realize that there is hope. But that takes change, and we are beaten down so many times, and we are just to the point where...
Yeah, good point. We're hopeless, and we're full of fear and hopeless because we buy into this ridiculous disease concept, and there's no cure, and there's nowhere to go, and we have to live with it. Pharmaceuticals don't work, and they never did work. They're suppressive for the acute to subacute. You move into chronic, they don't work anymore. You're into trouble. So that's part of the problems.
Well, think about it this way. All right, so you have an expectation, and you go to the doctor, and you get a bad diagnosis. You go to another doctor to get that explained, and he lets you down through it. You've got another bad experience.
There you go.
You go to another doctor, and the same thing happens. So all the time that you have these expectations, and they're unmet, and they create disillusionment and hopelessness. And then you finally get someone that you hear or see through a video, and what was that word? What did he just say? It just tickles. It tickles. Yeah. But it still takes a while for some people to latch onto that.
It does, because you're steep. And what's interesting is just what you said. They'll go to 10 different medical doctors looking for someone that might know the truth there. And yet the medical community has the same level of thinking. You might find some medical doctor here and there, and there are some much better medical doctors than others. No question, like there is naturopath, no question. There's some smart cookies. But pretty much you're in the same level of focus with diseases and the treatment concepts and things like that. No matter how good they are, they're still kind of steeped in that. You have to be a very natural, focused medical doctor that's used these protocols and stuff and seen them to break loose from that sort of thing. So you can't get out of that, because everywhere you go, they meet the same thing. And the sad thing for us is now that's true in the naturopathic field. The naturopaths are so screwed up with being trained allopathically that they can't help you either. So do you go to them on top of them, and everywhere you go, the same story. Pretty soon there's no hope. I get it, but we're the hope people. I'm going to tell you right now, we're here telling you that there's not only hope.
Well, you've said many, many times, most of our medical is taught theory, which then is taught upon theory, which is based upon theory, which is based upon theory. You get so far from the truth that it doesn't even... I mean, most medical doctors will admit that most of their training is in the prescription field, because look at how many prescriptions they've got to know about, the interactions and things like that. So while they should be busy with the anatomy and physiology far more than they are, they get so much of this other training in prescription.
Disease concepts and prescriptions to them. Absolutely. Horrible. They lose stuff. Yeah, absolutely. And so now it's going to become a big mess. But the PATs out there that are the A&P professors hopefully are learning how to teach the lymphatic system a little better, hopefully. But, they're a little restricted to the university they're teaching. They're kind of held a little bit in check, according to Pat, about what she can say and not say. And it's like, what? Universities should be free and open to truth. And when they're not, which is what's happening out there. You're seeing this blowback on all this fight between the liberal and the conservatives, and it's like they can't get out of the concept of being liberal and being conservative. For me, being liberal is being open to new ideas and things like that. Not socialism. It means liberal means being open. Conservative means you're stuck in and conservative in your ways. You're not, but that's not what it means. And so it's like all that both parties are messed up. It's like we need spiritual leaders.
So in my school that I'm taking for the naturopathic for animals, my next class, I have to write 2 essays on how I disagree with something. It can be any topic, but it's on how I disagree, and then I have to support my theories. But the fact that they're asking me to write about what I disagree with, do you know how well that would go over in some medical schools?
Oh yeah. Oh yeah. Oh yeah. You know what? I like that.
Yeah.
I like that because this actually.
Now I have to come across then on what I do believe and back that up.
Yeah.
But isn't that an awesome way to not only get out what we believe,
absolutely,
but to be challenged that way?
Now,
I love it.
You have the perfect subject matter for that. I'm thinking of the other students. Where are they going to get the subject matter? You have the perfect set, and you have proof because you've cured so many people of so many things. It's not even funny. So that's the thing. It's not like a student learning. You're already a practitioner. You're already a naturopath. You've already cured all kinds of people from all kinds of things. You're already extremely savvy on that. So it's them that has to learn. Unfortunately,
when I saw that, I got pretty excited.
That is exciting because this is when a student, actually not a student, a practitioner teaches a school a thing or two. Yeah, and that would be exciting. I can't wait for that one. That sounds good to me. And then finish this, my family think I am radical and extreme. Too bad, because you're just the thing they need. That's the thing. Those people that think we're radical and extreme, we're just the things they need. But you know what? You hold on because your family is only people that brought you here, brought your physical body here. Your true family is the God people. Yeah. That's your true family, are the awakened ones that know who they are.
But also, it's in the spirit of how you speak it too. That there's a phrase, speak the truth in love. In my faith, Paul said, though I speak with the language, the tongues of men and angels, but have not love, it means nothing. Yep. So think about how you're delivering that, because there's that other phrase that says you can catch more flies with honey. It's one of those things where truth is truth, and truth can be spoken harshly, or it can be spoken lovingly. And it's going to be received one way better than the other. Be the testimony.
I can't go, you get the lip system like this, right? I can't do it that way. Huh?
Probably wouldn't work too well.
Oh, no.
Your clients may go from being everyone around here to jailers.
Well, I tell you, there's a couple of our clients I want to do that too.
Oh, I get it.
God.
I get it.
You get it.
Yeah.
They're right. They can do it. They have the ability to get up out of those chairs. They have the ability to do these things, but they keep in the chairs because they can't get their self-discipline together.
Or there was the gentleman who had reversed. He no longer had bone cancer.
Right.
He no longer had.
There was 2 or 3 of them.
There was 2 or 3, and the tumor that had grown outside of the liver also had shrunk to where it was back inside the liver. And for a whole hour, what he wanted to talk about was how soon he could go back to eating other things. And I was like, "Don't take the foot off the pedal right now."
Oh my God! That's it. I mean, it's like the guy went in the hospital. He had cleaned up some of the cancer that he had, but he went in the hospital because he felt too tired, which is the adrenal bump. He was feeling tired. And they saw he was filtering and put him in ICU with heavy antibiotics, and he never left ICU. And his wife called me and said, they're going to kill him. I said, I know they are. You got to get him out of there. And the next thing you know, he was dead.
Yeah.
It's like, what?
I know.
God. Anyway, she says, we have clashed intensively. Well, it's not a family for you then, honey. It's a family that you can just give them the love and realize that you're for the world here. Your awareness is for the world, not for a few family members. Your divinity is to give the world the love and the understanding. That if they're not ready, that's okay. You give them the family love and keep on going. Mm-hmm. Keep on going. Because, like you were saying earlier, you spend time with them. They're good people, good humans, I'm sure, and all that kind of stuff. But remember, who you really are. And this isn't the world where you're really from. This is the world where you're playing. This is just your drama, your movie. That's all this is. This isn't where you're from. So don't take this world too seriously. Don't let it choke you. I've explained the need to clean the lymphatic system, eliminate mucus and acid-forming foods, and the renewal of cells. Apart from my sister, they accept the received wisdom of the status quo in vaccines. Oh, that's nasty stuff. And there's nothing you can do about it. And people will die with that in there. I'm learning to balance becoming awakened with playing in this physical level. See? They get it. And this is a soul that gets it. You play and you have fun, because if you don't, your experience isn't fun, and you're the one controlling the experience. They might not want you to realize that.
Yeah.
You know? There's a lot of dictators out there, including mates. So that's all neat. Great. Physically strong in myself. This year has been one of shedding the karmic unwinding. Good woman, she gets it. A spiritual shift is taking place, and I am humbled to be part of it. Thank you, dear friend, and the phenomenal team of the energy you put into healing us. Much love and grace, Susanna. My love to you, and from all of us.
Yes.
Just good work. Good work.
Right here, just one thing that she says. She says that she has observed. She's incredibly sensitive to others' energies and auras.
I saw that.
I have observed that if I'm around negative, low vibrational people, I feel very drained. Grounding yourself, but learning boundaries. Boundaries are key, and boundaries are important. Not to allow that negative to come onto you, and setting that, praying the hedge of protection, or figuring out how to protect yourself, however you want to term it. But just being strong in setting your boundaries so that you can minister but not take on.
Absolutely. I mean,
this one was a hard one for me. Robert remembers some of my teary crying spells in his office.
Yeah. It is a tough one, but I don't know what to say about it. You just have to realize, well, you have the freedom to be and do anything you want. You have to realize that. But who are you, and what do you want to give out to the rest of life, realizing that we're all from the same source? What do you want to give back to that? You want everyone's experiences to be uplifted and as grandiose as you can, because that means that that's God's experience, as grandiose as you can. It's going to experience as much as it can through every facet possible. That's it. I mean, it is all life. So just being a conscious part of that is incredible.
So I had a friend that posted a post on Facebook, and she said, list something adventurous that you have done and exciting that you don't think anyone else has done. And I don't remember so many responses, but each one it was like, oh, that sounds cool. I'd love to do that. And it just was so encouraging.
You're a good one for that. You do.
But
you've set up treasure hunts. You set up alligator wrestlings. You set up. I mean, she does in these little derby cars and crashes into everybody. She goes shark riding or wrestling or whatever.
I've never done that.
No, done that yet. But I mean, you're a classic example of what you're just saying in your life.
Well, it's about living life. But the point was, as you read through those, you got more and more excited, and you come up with ideas of things you wanted to do. Now imagine somebody coming along and posts, list the worst thing that's ever happened to yourself. Yeah. Now, imagine your feeling in reading through both of those. One is uplifting, one is encouraging, one is exciting, and the other one brings you down. And it's just, you've got to learn that what you hear, what you read, what you see, all affects everything within you, and you've got to monitor that. You've got to be careful. People go to the doctor, like this gentleman that went to the doctor and found stuff in his urine. He listened to the doctor, and it cost him his life. It really did. You've got to be careful what you take in, what you listen to, what you believe, and what you think of as truth.
So here's another way of putting it. We've talked a great deal about it getting outside of the mind, getting outside of thought and consciousness, being awake and watching the mind, telling the mind what you want it to bring back to you. And if when you're conscious, thoughts will come into you. We do this all the time between each other. We'll be talking, she gets an image, she's watching her thoughts, an image comes out, she talks about it because it's giving her images while I'm talking, same with my mind with her talking. So you have to sit back and become the observer. When you're totally observer, you can have a real negative person come up to you and none of your energy is going to be drawn to them. Only your God energy. And if you don't care and you're not holding on to your energy, it don't matter. You're not going to have them drain your energy because you're a channel for God's energy, for its energy, for the divine. You've got your sukkah, you're hooked to the vine. You don't want anybody to take you off point. You don't want anybody to pull you out of that. That is a big spiritual lesson, is not to let that negative person walk up and drain you. Even your mate can be that. You could have a mate this lifetime that's there to drain you, to test you. You know, it might be there for not a loving experience either. Not all experiences are that way.
The Abraham Lincoln and his wife.
Well, that's a good example. Don't call me fat. But anyway, that sort of thing. But you never want anybody to take you off of that. When you do, you just pull yourself back because that's how entities attach themselves.
Yeah.
They suck on you. And so you want to just be strong within the self, realize there's nothing else to you. You are the end all, the all. You are part of the all. There's nothing further. Get to that point where everything's external to you. Yeah. And you've got your freedom, you've got your protection, and you've got your happiness, and no one can take you off that point. Mm-hmm. Yeah.
Absolutely.
Well, with that, it's your lunchtime.
And
my
yours.
lunchtime and my lunchtime. We might as well go to lunch. You can get this up. We'll make it a short video. That way I won't get yelled at. And maybe I can come back and
tackle.
But I told him I apologize for lack of videos, but I'm steeped in iris analysis.
Yeah.
My God, I only have I'm thinking about 15 more. But it's like, you have, on top of the 14-week protocols and stuff, that's on top of that.
I know.
So it's...
That's why I haven't seen him.
I've been doing at midnight and 5 in the morning. It's like, what date is this? I'm not sure. Thank you, everybody. Yeah. We love you so much.
I won't see you beforehand, but have a wonderful weekend. I don't even know when this will come out, but whatever's coming out, have a good weekend.
We'll try to get it up tomorrow or today.
Yeah. There you go.
Get it up to Chris. Love you guys.
Many blessings.
Yes.